One of the things I like the most about the San Diego Food Bank is that we really have evolved away from being a food bank and really have become a nutrition bank. We know that nutrition-related disease is linked to poverty, and when people have less resources, then they can afford high sugar, high salt, high fat, and they have a hard time affording fresh produce, they have a hard time affording protein. So what we have are generations of unhealthy people, obesity, diabetes, hypertension, mental health issues. Poor diet at a young age actually can lead to mental health issues later on in life. So we have generations of unhealthy people directly related back to a poor diet, which is directly related to poverty. So one of the things that we really are excited about is that we are now a nutrition bank. We have a full-time registered dietitian on staff. We evaluate every type of food that we distribute, and out of the 26 million pounds of food that we did last year, about 9 million of that was fresh produce. You know, we really believe that education is the major vehicle to break the cycle of poverty, and we know that childhood education really starts with childhood nutrition. So for that reason, everything we do, everything we're distributing, especially for children, we're educating parents, we're doing cooking demonstrations, we're doing tours of grocery stores, everything to educate families and making sure that children can be healthy, go to school, get a good education, and be able to support their family. There's a little catchphrase that's used in the food bank community. If you don't eat, you can't learn. If you don't learn, you can't earn. One great example of that is our Food for Kids backpack program. This year we'll have 41 schools and 12 school districts, almost 2,000 kids getting one of these backpacks every Friday. And this program really goes to the heart of making sure that kids are healthy and can get a good education. We do measurements in all of our programs, but in this particular program, we're measuring absenteeism, academic performance, and in those schools, with that backpack program, we've seen a marked increase in improvement of those students' performance, so they can really focus on education and hopefully get a good job and be able to support their family. The San Diego Food Bank is now an officially registered diaper bank. What we've seen, the story we hear is single mothers, probably on CalFresh, and then they get a job, which is great, fantastic. That's a step towards doing better for their family, lifting their family out of poverty. They get that job, they get subsidized daycare, because sometimes, what do you do now? You have to take your kids somewhere. You're almost better off being on CalFresh, but they get that subsidized daycare. So now there's another hurdle, another step towards becoming independent. And then they go to daycare, and the daycare says you need to show up with 8 to 10 diapers. Well, diapers are very expensive. And so now we see these single mothers that they end of the month, they run out of money, they run out of diapers, can't take their kids to daycare, which means they can't go to work. They miss work enough times, they lose their job, they're back on CalFresh. So now we're committed to helping those single mothers lift their families out of poverty. We love that we're local and we're able to pivot and be able to adapt to community needs, and we're very proud of the work that we're doing here. So Alliance Healthcare Foundation, really appreciate your partnership, really appreciate your past support and your future consideration. Have a great day.